So this isn't something just kind of a quick hits. There is more literature about this out there, especially case reports. But once you get used to seeing the retroorbital space, you can identify abnormalities within it. So this is a case of an orbital abscess that was done by Dr. Tesserow here. And as you can see, we've got the globe, the retina, and this is the optic nerve, and then this is the retroorbital space. So you can see already there's some abnormal shadowing, which just doesn't look the same as the other side. It's not the same as the ones we've seen previously. So this is an actual abscess of the orbit. So this is a red flag and concerning. This is a case that we had here of a rhabdomyosarcoma. And again, you can see it just doesn't look normal in the retroorbital space. So posterior chamber, optic nerve comes through here, and then there's this kind of back in the retroorbital space that just doesn't look the same as the other side. So this ended up being a rhabdomyosarcoma. So is there any evidence for emergency ocular pathology? There are some papers out there. These are probably the best two. So in Academic Emergency Medicine in 2012, they did a prospective single-blinded observational study of a convenience sample that looked at the accuracy of bedside ultrasound performed by emergency physicians, staff, and residents for the evaluation of ocular pathology. In terms of training, staff had no. They each performed at least 15 to 75 ultrasounds prior to the onset of the study. In terms of the residents, they had a 1-hour lecture and a 1-hour hands-on session from the staff. The ultrasound was QA'd by 2 ultrasound fellowship-trained emergency physicians. Gold standard was ophthalmology evaluation and or CT. Of these three, they had 61 patients with traumatic vision loss, and 26, so 43% had intraocular pathology on ultrasound. Of those, there was 3 penetrating globe injuries, 9 retinal detachments, 1 central retinal artery occlusion, and 2 dense lens dislocations. Things that they did see was vitreous hemorrhage and vitreous detachment. So the emergency agreed with the standard exam in 60 out of 61 cases, so giving a sensitivity of 100% and a specificity of 97.2%. PPV 96 and PV 100. And so the one case where they didn't agree was a vitreous hemorrhage on ultrasound that wasn't seen on the initial ophthalmology exam. But when the ophthalmology reviewed the ultrasound findings, they agreed this was a real finding, and it's possible it could have been missed on the clinical exam initially. The other thing I'm putting in here is just a review paper. It's 2014 in the European Journal of Emergency Medicine. It basically just goes through ocular POCUS in the emergency department and things that you can find. So overall, we've been through a whole bunch of things. Make sure you use your ocular setting. Make sure to use a gentle technique. Remember to increase, decrease your gain, look all around, transverse, longitudinal with left and right movements and up and down movements. And we've gone through different types of pathology and some of the specific things to determine blind spot. And if you're concerned, then get your other tests in addition. Any questions?